I would like to thank everybody for being with us today. Thank you for joining us for this webinar on myoma radiofrequency ablation. It's a pleasure to have you all with us today, and it's nice to see such a large, varied crowd from all over the world. We are honored to have Dra Canete present our webinar today. Dra Canete is an internationally renowned expert in the treatment of myomas. The intention of this webinar today is to introduce you to myoma radiofrequency ablation, let you know a few details about the procedure, see where it fits in with other procedures out there, and hopefully entice some of you to visit Dra Canete in Spain to attend one of the master classes she organizes on a regular basis, where you could find out more about the theory of the procedure. You can see live cases and actually practice the procedure itself using the actual equipment on myoma phantoms that we provide. I want to thank Dra Canete for being with us today. Thank you very, very much. Just a small note to all the attendants: the questions and answer session will be done at the end of the webinar, as explained in the invitation. It will be done in writing using the question and answer option you have at the bottom of your screen. Questions will be answered verbally. Now, if for any reason we run out of time, any unanswered questions will be answered, but we would do that by email within a few days from the webinar. Now, I'll take this opportunity to thank you all for being with us today. It's really nice to see such an attendance. And with no further delay, I will give you Dra Canete.
Thank you for your presentation. Good afternoon, good evening for all participants. Thank you very much. We are going to speak about 4 topics. The first topic is introduction to myoma treatments. The second topic is myoma radiofrequency ablation, indication, contraindication, advantage of technique. The third topic is myoma radiofrequency masterclass. I am going to explain what is the structure of the masterclass. And the fourth topic is the real case demonstration video. We are going to speak about general aspect about myomas. In a report from Cardoso in 2012, Cardoso speak about the cause of uterine leiomyoma in the United States, and you can see how uterine fibroid, the cause is more than double the breast cancer. So it's a problem, benign problem with a high cost in United States and in over the world. It's important too to speak about hysterectomy rates over the world. There is very different in different countries. For example, in UK, you can see the incidence of hysterectomy by rates by benign procedures is 100,000. In United States is 143 in 100,000. In Canada is 106 in 100,000. And in Spain we had 65 per 100,000, but we apply different procedures and we reduce the incidence of hysterectomy rates 28 per 100,000. It's important we remember the tumors, the myomas is benign tumors. It's different the origin of leiomyomas than myomas, the leiomyosarcoma than myomas. But if we speak about the risks of malignancy, if the woman is less than 45 old, the risk of malignancy when we are going to remove a leiomyoma is between 1,900. And the risk of malignancy in more than 45 old women is between 419. Recently, non-surgical treatment are development, and sometimes majority fibroids don't need treatment. Sometimes, some years ago, we used ulipristal acetate, but recently the European Medicine Agency has forbidden these pills, so we can't use these pills. Now we have antifibrinolytics, oral contraceptives, or intrauterine device. Other possibility is endometrial ablation with radiofrequency, balloon or cryoablation, uterine artery embolization, HIFU, radiofrequency, bilaparoscopy of vaginal, myomectomy with vaginal laser. It's very important to go from less for more invasive, because in medicine in general, it's very important when you do an invasive treatment, you have see before non-invasive treatment. One of the normally question about radiofrequency is what is indication? The main indication is clinical criteria. Majority of patients is bleeding. Bleeding is one of the most more frequent indication for radiofrequency. But in the last months, the more frequent for treat, it stopped growing. Asymptomatic myoma in young women who don't want pregnancy at this time, and come now, and the myoma has 2 centimeters. 6 months after the fibroid has a high vascularization and 3 centimeters, and when come back the young women and say, and I say the women, the fibroid is 4 centimeters, and the women say, I want to stop growth. So the radiofrequency is a good option to stop the growth of a fibroid in a woman who don't want pregnancy at this time. One or more abortion, intramural myoma, because intramural myoma some times ago say it's not important for a pregnancy, but now we know intramural myoma has produce in some cases contraction of the uterus, and this contraction is very frequently produce an abortion. So if the patient has an intramural fibroid, has one or more abortion, and the patient won't reduce the fibroid, a good option is radiofrequency transvaginal via. The ideal size of fibroid is less than 180 centimeters. More or less is a fibroid of 7 by 5 by 6 centimeters, more or less. Is the ideal, is the best results. Can I do a radiofrequency in a fibroid with 10 centimeters when a size of 200 or 300 cubic centimeters? Is possible, but you haven't a good results. You haven't it's not a good option. Now we are going to see my results in the first years, and was worse when the fibroid was near of 10 centimeters or 200 or more. So it's the best option less than 118 cubic centimeters. And number of fibroids is recommended less than 3 number of fibroids. Can I do if has more than 3? You can, but if you have a lot of fibroids, you must treat a lot of tissue, and we haven't reports, we haven't studies with a lot of fibroids. So I think it's a good idea is be prudent, be quiet. So transvaginal radiofrequency with electrode, what is the advances? For me, it's important is for the patient is the cheapest method of radiofrequency. There is 3 methods, and this is the cheapest. We can use different tip sizes to treat different sizes of fibroids. This is important. I use normally the largest needle, but the largest electrode, but it's important you can use different tip size, because if the fibroid is 7 centimeters, probably you need 1.5, and if the fibroid is 3 centimeters, probably with 0.5 is enough. And we can reach, this is the most important advantage for me, we can reach the fibroids through the cervix or anterior or posterior vaginal sac, because laparoscopic method of radiofrequency, for me, I prefer, if I am going to do a laparoscopy, I prefer remove the fibroids. And with Sonata system, you must go transcervical. Transcervical is compulsory, and sometimes it's very difficult to go transcervical. So this electrode is possible to go by the cervix anterior or posterior vaginal sac, and this is soft, and this is very easy to go there. So I am going to speak words only about Myoma Radiofrequency Masterclass. We do it in Madrid, Spain. This is the program in the last one in February, and we speak about clinical evidence and explanation of different kind of radiofrequency, diagnosis of myoma by ultrasound. We speak about 3D ultrasound and elastography, myoma transvaginal radiofrequency, how to do. We have practical simulation with phantom. It's very interesting, this one. We presentation, the next day clinical casing, conclusion and message to take home. And we have, the next day, we do 2 cases of fibroid treatment with vaginal radiofrequency, and again we do simulation in operating room with phantom and meet, and it's very interesting to do this one. You can see this is the master class, theoretical class. After, with high definition ultrasound, we do 3D vascularization of fibroids, and we do elastography too. We see with radiofrequency power the difference. You can see in this power and other power, we see the difference power, how in mid we can the effect in the mid, the radiofrequency. And this is the phantom. You can see the vaginal proof, you can see the electrode, and you can see the simulation fibroid is very real, and you can prove before the surgery with the phantom. This is the ultrasound, and the group normally is 6, so from 6 to 10 is maximum, and everyone can try with the phantom.
About 20 to 30% of women at childbearing age have myomas, which may cause severe pain, frequent urination, and excessive bleeding. There are 4 types of myoma, and the most common one is intramural. RF Medical's VCTM electrode has a variable exposure tip which can be adjusted according to the size of myoma to be treated. The length of the electrode varies from 20 centimeters to 35 centimeters, and the length of the active tip can be adjusted from the handle. The electrode is connected to the generator and the inflow tube to the peristaltic pump. To perform Myoma RFA, a needle guide must be attached to the vaginal ultrasound probe. The needle guide allows the electrode to be inserted parallel to the ultrasound and facilitates myoma targeting. After confirming the position of the myoma with the use of ultrasound, insert the electrode in the myoma and position the active tip in the center. Depending on the size of myoma, the length of active tip and ablation time may differ. Extra caution must be taken in order to avoid heat transmission to nearby organs. This is achieved by underablation of the myoma. The size of ablated myomas will gradually decrease over time.
So we are going to speak about summary, only summary. Radiofrequency is a safe and effective technique to treatment of myoma. The best size to treat vaginal radiofrequency ultrasound is less than 180 cubic centimeters. The number is the best number is less than 3 myoma. Reintervention in the 3 years is 30. 5 years, 26. The radiofrequency medical needle is the cheapest option if we compare with uterine artery embolization, high fusionata system, Acessa system with the same reintervention index and safer. Pregnancy after radiofrequency is safe in this moment, but we need further study.